Greetings, welcome to this section of the MPJE review. We'll be delving into the crucial aspects of counseling requirements under OBRA 90, and we'll navigate through the intricacies of the signature log, data collection, and documentation. First up, we have the offer to discuss. Every new prescription is an opportunity to connect with the patient. Written or telephone offers are permissible. Pharmacies must provide toll-free access for patient inquiries. Counseling is not mandatory if the beneficiary patient refuses. Once the offer is accepted, the discussion process kicks in. Whether it's in person or over the phone, effective communication is key. We're not just discussing medications, we're building trust and ensuring patients understand their treatment plans. Now, let's talk about the mandatory discussion points. Federal law guides us here, emphasizing specific details that must be covered. This isn't just a checklist, it's the backbone of informed decision-making for patients. Discussion must cover medication name and description, dosage details, special directions, common side effects, self-monitoring techniques, storage, refill information, and misdose actions. Let's start with the signature log. This log is a pharmacy's silent guardian, holding crucial information about prescriptions, counseling, and beneficiary signatures. It's not just paperwork, it's your financial safeguard. Clearly distinguish between accepted and declined counseling prescriptions. The absence of a signature may lead to fund recoupment, emphasizing the importance of meticulous record keeping. Moving on to data collection requirements. Beyond signatures, pharmacies must make a reasonable effort to obtain comprehensive beneficiary information. This includes details like name, address, and medical history. Remember, this is not just a legal obligation, it's about delivering patient-centered care. Now, documentation requirements. Once you've gathered this information, how do you store it? It's not just about retention, it's about efficient organization. Rule 338.490 expands beyond OBRA, emphasizing positive patient outcomes. Your duty is to record this information in the beneficiary's profile or other records, retaining it for 7 years or longer. Here, we focus on how you communicate vital information to the patient. Oral communication is preferred, but printed material can suffice if barriers exist. This rule mandates communication with each new prescription, with optional provision during refills. Importantly, if the patient refuses, there's no obligation to provide consultation. Now, let's discuss documenting the process. Remember, every interaction is a part of the patient's story. However, if a patient refuses consultation, there's no need to document the refusal. This emphasizes the patient's autonomy in their healthcare decisions. OBRA 90 sets federal standards for Medicaid, and its counseling requirements emphasize patient-centered care, including the offer for counseling with each new prescription. If a patient refuses counseling, OBRA 90 suggests documenting the offer and any discussions that may have taken place. While Rule 338.490 in Michigan might not explicitly mandate documenting refusal, the broader federal guidelines provided by OBRA 90 should guide your practice to ensure compliance with federal standards. For MPJE preparation, understanding this nuance is crucial. It implies that even if state-specific rules don't demand documentation, the overarching federal standards encourage it, ensuring your practice aligns with comprehensive and patient-focused care under OBRA 90. As we conclude our journey through counseling documentation, remember, accurate signature logs are not just paperwork, they're financial safeguards. Comprehensive beneficiary information is the foundation of patient-centered care.